Hello there, guys. Got some wild hair going on today. Anyway, it's so peaceful. It's so quiet. I want to go and reach my hat because my hair is a little bit wild. I'm actually thinking of getting my straighteners out in a bit and giving my hair a little bit of a straighten. And even thinking about going and getting my eyebrows done and starting to think about the fact that I've been chewing my nails constantly. And I had a little bit of a look in the mirror earlier on and went, wow, I've like aged. So I'm like 43 soon, in a couple of months. But just an update on said head. I am challenged now because what is going on in my neck has advanced, and the challenge is it's actually pushing behind my eyes, in my ears, around in my jaw. So for people who don't understand what's been going on my whole life, Dean is on board and Dean gets it. Dean has taken the time to watch the video. He's understanding what the fuck's been going on. My mum has just emailed me to sort of call me all sorts, and as far as I'm concerned, me and my mum are now officially done. So basically, I was born a child that was very hypermobile, very flexible, very floppy, very gloppy, and nobody's ever really known what's up with me other than probably being a little bit ratty, moody with pain. I don't know what that was. I think a bumblebee's just entered into my house. I've already got a bumblebee out this week, but I think a bumblebee's just entered my house. So anyway, I think the first times I sort of remember, I used to keep my coat on when I was a kid, and I used to sit sort of slightly upside down, always trying to sort of push back on my neck and my back and things like that. My dad, as you know, I live with my dad, not my mum. And my dad was martial arts and things like that. So I was very supple, very flexible, always sat in the splits, things like that. I wasn't diagnosed with hypermobility Ehlers-Danlos syndrome until I was 22. The reason that it was so late diagnosed because I had my mum telling everybody that I was a liar and attention seeker. I had the underlying issues because obviously being so flexible, having people getting you to do the splits, it's a very thing that people use to groom for sexual abuse and things like that. So there was that sort of factors going on too. That's not my fault. It's not for people to penalise me over. So anyway, basically, I've asked people who give a damn about me to watch this video. And the reason I'm asking to watch it is because they're going to realise that with the hypermobility Ehlers-Danlos syndrome, there are particular situations. I'm not going to see a chiropractor now because I've watched this video, and yes, chiropractor is absolutely brilliant for me. Osteopath is the answer all the way through. But if what is going on with the tonsil of the brain, I don't know the word for it, is exactly as this man is explaining, as I feel, and I'm getting closer and closer and closer to getting this document together that explains to people exactly that all that has been going on is I've been going into A&E, having a laying down MRI scan and being sent to mental health with being told it's in my head, I'm making it up, there's problems, mental health, blah, 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 blah. As you know, there was an appeal for a young girl called Bethany who's been going through this in her teen years as well. What goes on is because of having hypermobility, so as you see things like this all goes on in the neck, all the way around, blah, blah, blah. Right at the base, if you literally put your fingers behind your neck, yeah, this is literally what is just holding on your head onto the thing. I have to be really careful at the moment because if you understand labour and you understand contractions, yeah, a Chiari malformation sits contractions. I'm now what's going through the next stage of this. So I would have only, at this point, only been sitting, I think it's a 1 or something like this, a Chiari stage 1. I'm now moving into a whole new stage because it's now pressurized, it's trying to push through, it means the gap's getting bigger, it means it's really trying to come down. What that basically means is if I go and see the chiropractor and it's down and it's moving down, then basically I could end up in a paralyzed state. I could wake up at any point in the morning and end up in that paralyzed state. So Dean's now getting it. We're trying to push through. We've got people working, doing different things, filling out different forms, trying to get all the paperwork right to push over. So my GP, not the person who wrote the letter that was doing it all, but the doctor who's taken over, who you don't really get to see. So as much as my thumb needs fixing and everything else, I've really got to focus on this neck problem. So basically it's back to a neurologist. Now, the people who are understanding of what's going on is the people in the States, not the people here in the UK. EDS UK and EDS Society are two very different things. One is in the States, one is here in the UK, but they're the main frames and main bodies for people like us. It's no different than somebody who is diagnosed with arthritis and is part of an arthritis society. It's no different than people Downs and Down Society. For me, my diagnosis is hypermobility EDS, and with that is a management plan of looking after yourself, nutrition, blah 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 blah. As he says on this video, if the Chiari is down, you are to cease and stop from all physical activities immediately, as in all your exercise and stuff, because you're going to aggravate, make it worse, blah 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 blah. He will not do any of the treatment on the neck until it's been decompressurized or whatever it is. And that means you have to go over to Dr. Fraser, who's a neurologist. This is the point that scares me, because I don't want surgery to be my only answer. But nobody is going to treat me for anything other than muscle spasms in my neck until I get an upright MRI. My doctor isn't able to refer, as the text says. I have to go back to physio again. Every time I go to physio, they get me to do the same. Can you turn your neck to here? Oh, I've got to be careful. It is down. Oh, shit. If I went to see them now, you know my floppy galoppy neck that you see that goes forward and back at this particular point? I can't do this. I have an absolute radiating pain all the way back up into my head at this particular point. It's pushing all between my eyes, which is new, all the way around, and I can get it all the way in my ears at the moment. Dean's at Explorer with the boys at the moment for one of the group things that goes on, and he's taken them where I would usually go on a Tuesday with them, which should be interesting when he gets back. Oh, it should be interesting. So anyway, the moment I've had this upright MRI, I know 100%. The people in America know. I already spoke to Dr. Fraser when I'd gone to the EDS UK place when America came over. I think it was the week before I was opposing the adoption order, and I literally had everything ready, and it's like, but yes, you haven't got the scan to prove it. And my doctors in Liverpool were working so hard, and then I didn't get back to Liverpool because I was down here for the court case, and it all collided and went completely fucking KO'd. And the thing is, like he says on the video, it isn't going to get better. It is only going to deteriorate and get worse until it ends up with you in A&E again. And the problem with this is, because of my paperwork, it just goes back around the same situation, that if I went in, they'd go, yep, you got muscle spasms, blah, blah, blah. It's not muscle spasms. We know exactly what it is. If you ask any person within the EDS community, and if there is any EDS community people here, they will be able to tell you themselves. I'm not the only person going through this. I'm not the only person that is being neglected. As Professor Graham said, EDS is the most neglected of conditions. My mum and my sister are like, yeah, we don't have problems, we do this, we look after ourselves, blah blah blah. That's bollocks. So anyway, with conditions comes pride. I will do what's called like lifting up my neck, and I'll try and pull it up to try to get the release and things like that. I don't know whether I'm ever going to get this back up now or whether it will stay. Time will tell, things like that. Dean will probably come in and try and give me a lift up. We might speak to Nick and see what's the best thing to do. Nick will say if it's down, he can't do anything without the scan, but they would then go without all of the information that is on this video. There is only, I think there's an upright MRI in London, Leeds, blah, blah, blah. But it's 1,400 and something per scan of the said spine. The reason that you have the upright one is because even if I was in a laying down one, this position is completely straight. When they put you in the upright one, they move you forward and back and things like that. So they get to do the full rotation of all of the axles within the neck. The neck is such an important thing. If anybody has any accidents, people are always told stabilize the neck. When it comes to Kelly, it's about not even believing me. It's about caring or wondering or even asking. Like, I'm literally ironing at the moment. So I've just stopped because I'm literally just ironing. I've got bits here and it's spring. So all of the winter stuff now, if it's not going to fit the boys for next year, it's all going off to the stuff that I probably even send it off to help the people.
Instantly got better than doing nothing at all. Therapeutic exercise alone and manual therapy alone.
Can you hear this?
Not a little bit.
Just buzz me if you can hear what's just clicked on.
And this research was done in the 1980s, the 1990s, the early 2000s, and in the 2010.
Let me know if you can hear the video that's playing, please. That would be really good, because I'll leave it
Stills
if it is.
said back in 1880, 1890, align the patient, exercise them. And we're finding out today in 2000s, they're saying align them and exercise them.
It's the aligning I need.
Physical therapy deficits that you're going to have with craniocervical instability, Chiari malformation, or any type of connective tissue disorder that involves hypermobility. You have joint laxity and instability, muscle weakness from underused muscles.
Just let us know you can hear it.
You're going to have
Otherwise,
muscle
I'm just
weakness from
sitting
muscles
here
that go into
looking.
muscle spasms because the muscles are too tight and they're not allowed to relax, so the muscle will eventually fail. There'll be a lack of proprioceptive input, particularly with my patients that are not getting good coordination in their feet, particularly with their Chiari malformation, and some of my craniocervical instability patients where they have some cranial settling and their nerves in their neck are getting compressed.
So fundamental.
And they're going to have
And
poor
it's getting the schedule,
cardiovascular
and this is what we're
endurance.
doing at the moment for me, Dean, and the boys.
The best treatment options,
health
as
is
we just
vital
talked
for
about,
everybody.
manual therapy,
Can you hear
therapeutic
this?
core stabilization exercises, therapeutic joint stabilization exercises, proprioception exercises, and cardiovascular endurance
Can someone
exercises.
just let me know if the video in the background is actually playing?
Structural
It's switched
manual
on by
therapy.
itself.
What I do with a lot of my patients, I utilize these techniques, and these are the techniques that you're going to look for in your physical therapist that does manual therapy. They do muscle energy techniques, myofascial release, Jones strain, counter strain, cranial therapy, craniosacral therapy, visceral manipulation or mobilization, and manual lymphatic drainage. Another technique that you'll see out there too that gets done a lot with these patients is called zero balancing. So now I want to show you a manual therapy treatment session that I do with my patients.
And it's down much further, much further.
I'm not going to talk about the slides. I'm just going to go through them, and I'll show you the before and after picture.
It's down much further.
I'm just doing a myofascial release to her rib cage and her thoracic paraspinals, a myofascial release to her pelvic floor, a sacroiliac joint decompression, a diaphragm release.
So the video is
a thoracic inlet release,
an osteopath,
a hyoid release,
who specialises in this and knows what he's talking about, but he's in America. And this is why I said to the courts when they took Aaron and Faith, like, you just prevented us going,
so that you don't
like,
bring on nausea or
over
make
to
them
America
vomit.
to finally get treated. And the thing
This
is,
is
this treatment,
craniosacral therapy. This is called the classic claw grip.
I'm being denied the treatment because people are refusing me
parietal bone release,
the conversation,
and I end with
to
a
even
craniosacral with what they
understand
call a
what's
CV4,
wrong
which is,
with me.
it just relaxes the whole skull and neck.
Ooh.
When I'm evaluating my patients from a craniocervical instability standpoint or a cervical spine standpoint, I have her in the resting position here on the left,
the bottom and the top.
and I
So anyway,
asked
I
her to
don't want
bring
to
her
bore
chin
you
to her
with this.
chest. when she brought her
But
chin
I
up to
have
her
no
chest,
choice
she
but to
deviated,
pull
as you can
this
see.
together
Her
properly
nose
now.
went to the right.
And it doesn't matter if I'm
Your
outside with the
occiput in
garage,
C1
sailing,
will
Dean's
flex,
upholstering furniture.
means
We're both
come
getting back
forward,
into art and
side
selling
bend one
things and
way,
trying
and
to sort
rotate in the
things
opposite
out at the
direction.
moment.
Your C1 and
Working
C2 do
together
that
really
same thing.
well
They'll
because even
flex
he's
and side bend and rotate in the
understanding.
opposite direction, or they'll extend,
Like I said,
side bend and
look,
rotate in the
I said,
opposite
if I
direction.
wake up one
The rest of your
morning and
cervical
it's
spine
dropped that
from
far
C3
that I'm
down,
in what's called a paralyzed
flex, extend,
state,
and side bend in
which
the
is
same
what
direction.
happened to
But this
me.
is where it gets unique. When she lifts her head up this way, this is an occiput dysfunction. So she brings her chin up, her head deviates off to the side. So I know I have to work on her occiput and her C1. She does have craniocervical instability.
Fact.
And I'm just doing, now I'm actually physically doing a gentle muscle energy technique to her OA. It's a gentle isometric muscle contraction.
To get people to go boom, 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 and do the
And I
things that I
teach,
can't
I do this
for
with my patient
myself.
also as an alternative
What
muscle energy
upsets me
technique,
is
but I'll also
that
have
my
the
mother
patient do this
doesn't
technique on her
believe that
own
I'm
for
worthy to be
self-correction
treated.
without my hands
They would
there to help
rather
balance
keep
her
going
her
over the
occiput and
mental
her
health,
C1.
saying it's in my head.
So
As
all
he
of my
says,
patients
yes,
I'll do
it's in your
manotherapy on.
head.
I will
Dean's
teach
on
them
his
how
way
to
back
fix their
saying just
own
said see you
alignment
soon.
issues,
So,
and then I'll give them exercises.
you know, I have the rights to be
This is a
able to
muscle energy
train
technique for her
physio.
low
My
back.
boys have
Remember I
physio
said earlier
plans.
today that if
And
you have a
that
neck
is
problem, you can also have a low back
priority
problem.
because without
It's all
that,
connected.
once you
She has a
stop,
low back problem,
once you
particularly at her
stop that
L5.
routine, we crash and we
She has
burn
an
out.
upslip. And when I'm
But
doing these
this
techniques,
is not
I'm
going to
using a
get
very
better.
short
It's
lever
only
arm
going to get
so that
worse
she can't hurt
until
herself using any of her joints subluxing or dislocating. And I'm making sure that her contraction or her resistance into my hands are
But
very,
you
very
listen to
gentle.
the people on the
No
website,
more than
yeah?
a couple
Or
pounds.
listen to the
No more
people
than a
who know
couple
what
pounds,
they're
anywhere
talking
from
about. And I've
1 to
proved
5
and
pounds
shown
of
the
pressure.
evidence that I
Now,
have
when I'm
these
doing my
legal
muscle energy techniques
diagnoses,
with my patients,
irrefutable
I'm looking to move
GP. But
one
the
muscle
trauma
of the
in between
602
me and
muscles that
these
they have in
medical
their body
people and
to
dealing
move
with people who
one
don't
of the
understand,
206 bones in the body.
you're
So it
dealing
is a
with my
very
neck.
specific and very gentle
You're
technique.
dealing with people messing with my brain here.
And
This
this is
is
for an
my
upslip where
brain
she has a
that's
short
going
leg.
out. Do
This
your
is
own
for her
research
sacroiliac
if you give a
joint.
shit and want to understand.
This is what she looked like before I saw her. On
And if
that,
you
this
can't
treatment,
help, you don't want to be part of
came
this,
in with a head like
you have
this,
no right to
shoulders rounded,
hinder.
head
Not the
tilted off to the
website
side
people,
and
not
rotated,
anything, because
side bent and
I've been
rotated.
telling the
And
truth
after
the
I did the
whole
treatment that you just saw,
time.
this is what she looked like.
And he's telling you,
After
and
one
every
treatment.
other medical
Is she going to stay
people,
that
and
way?
EDS
No, remember, we
UK
got to start to
people,
exercise the patient.
listen, yeah,
Okay.
it's all
So I
in the
started
thing.
her off on some
But I
very
can't
gentle
do
exercises.
it until the
When I
decompression
start my
is
patients with
done.
craniocervical instability
Or
or
I just have
any
to
neck
stay
issues
like this. And anyway, it's burning down my
that
back and
have
it's getting really horrible.
hypermobility,
So this is why
I
I
always put them in
move
their neck
and
brace.
do
She's
all
wearing
the
a Miami
things.
J. Dr. Henderson likes to use the Vista. There's also a Philadelphia
Anyway,
collar that I
at
like
least
to use.
Dean
It's this
gets
ugly
it now.
orange colored brace
Thank
that you
God
can
for
actually
that.
cut,
He even actually
and it
asked
can
if
be
I wanted
heated
to
up
go
and
out
molded
with
to your
him
neck a little
today,
bit better, but
I
it is
sort of
not
ignored
as
it
rigid
and
as the
was
Miami
like,
J or
right,
the
anyway,
Vista.
I've got lots to do today, so
This is another patient doing a isometric.
spring and
What I wanted you to
see
see
how
was,
it
you see
goes.
the muscles
Anyway,
right there?
ugh.
They're contracting, and she's only using
It's
very
horrible.
gentle pressure.
It's like being in labour
making
in
sure
that area,
in this
but in the
picture
back
with
of
my
my
hands
head.
that she's staying at right angles so that she can't sublux or
Let's
dislocate
hope
her
it
joints.
does. I don't know what the stages are. I
Same
don't
thing
even want to
with
know what worst
Amanda
case
here.
scenario
I'm holding her elbow
I
just
just
to make
hope
sure
it's
she
going
stays
to
in the right plane
alleviate,
and that she's not
get
getting
back
too
up
much force
again.
put through her
But I
arms.
can't keep dealing with this anymore.
This
It's
is
got to
Michelle
get
again.
resolved and
I
sorted.
come up
It's
with a
not
way
fair.
to exercise if you can't use your
And
hands
Mum,
because of hand
you
problems,
can't
wrist
watch the
problems, shoulder
video,
problems.
mate, and you don't
If
give
you
a shit about
deviate
your own
and turn your
daughter,
eyes, if you don't
and
have
you
any eye
don't
pressure
get that
issues,
you've all
if you turn your
created
eyes to the right,
paperwork that changes people's
you're going to
opinions
contract
of me,
your
and trust has
sternocleidomastoid.
been
If
completely
you turn
broken
your
in
eyes to
the
the left,
system.
you're going
If you
to
can't be a
contract your
fucking mother, then
sternocleidomastoid. In
stay
this
over
case, you
in
can see
Singapore
Michelle
with your real kids, mate,
turning
and
her
your
eyes to her left,
grandkid,
and you can
and
see
stay
her
away
right
from mine.
sternocleidomastoid contracting.
Don't need it. I
Your
was
right
telling the truth my whole
sternocleidomastoid
life.
turns your head to the
Now
left.
I'm saying I'm 44 and I'm not
It will
putting
side
up
bend
with
your
it
head
or the
to
bullshit
the same
anymore.
side, and when you use both of them at the same time,
Getting
it will flex
sorted.
your head
I
forward.
deserve it. I want to believe that I'm
Then
going
I
to
had
skate.
her do
So
it with her
April
hand,
skates.
and
Will
I
I
had her
be
add
there?
a
I
little
don't
extra
know.
motion with
I
her
don't
eyes
know.
because she was pushing too hard with her
I
own
don't
head,
know.
and it
I've
gave
got
her
to do
neck
my
pain.
own
So
research
instead of
now
her
and
using her
learn what
head
the
to
fuck's
push,
going on
I
and
had to
what I
use her
can do
eyes.
myself and and how I can get there myself.
And this was just a nice stretch when she was nice and
I ain't
stable.
escorting myself
This
to
is to
pay
show
for
you
the
that I do
fees.
some
No, I'm
stretches
not
with my
going and
patients if
dancing
they
at
have
Wiggles
tightness
to pay for the
only
fees.
after they've been
I'll be out there
stabilized.
righteously selling
And as you can
things
see, she's
until
getting a
I
really
nail
nice
it.
stretch of her scalenes
I've
right
got to go
there.
and find out the full length all the way
This
through.
is Amanda.
So I've
This
not
is
got
when
to
she
be
first
left
came in to see
halfway
us. She could
through
barely
running
bridge
out of
off the
money.
mat. We started to teach her some bridging exercises. This is her after about a couple of weeks of therapy. Look at the difference in the height. She has had to exercise in her Vista cervical collar.